Hi, I'm Kevin Knauss with InsureMeKevin.com. And recently, with the whole coronavirus pandemic and things being closed, reduced hours, people being laid off, I've been getting a lot of calls from clients about whether they should reduce their income in their covered California accounts. Because if they do that, then the subsidies they were receiving will go up and will help them make their health insurance premium payments. And that can be a good thing. You just want to have an idea, get your arms wrapped around the big picture of what it means to change your income in Covered California or healthcare.gov or one of the other exchanges. So the subsidies you are receiving for 2020 every month are based on your annual estimate of your income. Now, if you take that down in California, your subsidy will go up as the income goes down. However, if you take your income below 138% of the federal poverty level, which is the threshold for Medi-Cal, you will be put into Medi-Cal. Now, that isn't necessarily a bad thing because with Medi-Cal, it's no cost. It's modified adjusted gross income Medi-Cal, and it is not based on your assets, only your monthly income. And it's no cost, so your office visits, prescriptions, and that could be a tremendous help when you have reduced hours, you're laid off, if you're self-employed, you're not able to work at the hair salon, or your contracts are not coming in. So that can be a real benefit. Now, for if you have children in your household, they become Medi-Cal eligible when the monthly household income is below 266% of the federal poverty level. Now, I know that's complicated because it's based on family size, and there's income charts on my website, InsureMeKevin.com, under the Medi-Cal tab. But again, you need to consider that if you do reduce your income, let's say everyone is getting a subsidy right now in Covered California, but if you reduce it, the adults may still be getting a subsidy, higher subsidy for their health insurance, but it may put the children into Medi-Cal because it's a higher income threshold. Now, that may not be bad because you would not be paying a premium for the children. But whenever your income goes back up, and you need to report income changes to Medi-Cal within 10 days. When that income goes back up, you have to report that to Medi-Cal, not Covered California, because it's Medi-Cal that releases adults and children from being eligible for Medi-Cal, not Covered California. So for some people, it's kind of flip-flopping back and forth, but if it's saving you a lot of money in these very difficult times, then it may be worth it. Now, something else to consider is you are getting the subsidies based on an estimated annual income. So you take your income down, but if at the end of the year, your income, when you do your taxes, is pretty much what you estimated at the beginning of 2020, but you lowered your income in the middle of the year and you got more premium tax credits, you may have gotten excess premium tax credits than what you were eligible for, and you may have to pay some of those back. There is an IRS repayment limitation, so as long as you're under 400% of the federal poverty line, you will not have to pay all of them back. But it's still something to consider. If you think your income is just kind of taking a momentary dip and it's going to come back, and the estimate that you've made for 2020 is going to be relatively accurate, then maybe you don't need to change it. But you know, cash is cash, and if you don't have cash coming in, and you have a $3,000, $4,000, $1,000 a month health insurance premium, and you're in Covered California, then you need to look hard at reducing the income so you can get the benefit of the Affordable Care Act and subsidies to reduce your health insurance. Because again, cash is cash, and it's better in your pocket than someone else's, like the health insurance company sometimes. So those are a couple different things to think about. You may have different scenarios. Go ahead and leave them in the comment section. You can email me. I'll try and answer them because this is all very complicated. But be safe, and thanks for watching. If you found this useful, go ahead and share it with somebody else. Thank you so much. Have a wonderful day. I'm Kevin Knauss with InsureMeKevin.com.